Dear student, I am Dr. Prakash Mungli, Professor of Biochemistry. So in this connective tissue lecture series, I will be going over fibrillin and applied clinical aspects. Let's get into the details. Fibrillin, which is an extracellular matrix protein, it is synthesized and secreted by fibroblasts. And fibrillin 1 is a major structural component of microfibrils which are found in the extracellular matrix. And also fibrillin 1 is necessary for biogenesis and maintenance of elastic fibers in the extracellular matrix. And note that fibrillin 1 binds to latent form of transforming growth factor beta and keep it sequestered so that transforming growth factor beta do not have a overactivity. So fibrillin 1 normally it controls the activity of transforming growth factor beta. Now fibrillin 1 is coded by a gene called as FBN1 gene, which is located on chromosome number 15. And the fibrillin 1 it is found in elastic fibers, and also it is found in elastin free bundles that are seen in eyes, kidneys and tendons. That's why whenever there is a defect in the fibrillin 1, it will affect all the tissues wherever fibrillin has got a major role. Now let's move on to see a disease which is related with a fibrillin protein called Marfan syndrome. Marfan syndrome, it follows autosomal dominant pattern of inheritance and mutation in FBN1 gene coding for fibrillin 1 is the cause for Marfan syndrome. Because fibrillin 1 is mutated here, so it won't be able to sequester transforming growth factor beta in the extracellular matrix. Thereby, transforming growth factor beta will have overactivity, and also fibrillin 1, since it is not synthesized properly or if it is defective here, it will lead to impaired functioning of elastic fibers. So there are two effects of defect in the fibrillin 1 protein because of mutation. One is there is impaired functioning of elastic fibers. The second is overactivity of transforming growth factor beta. So because the transforming growth factor beta has got overactivity in Marfan syndrome, some of the drugs referred as like angiotensin 2 receptor antagonists like losartan that can antagonize transforming growth factor beta, and these drugs could have a beneficial effect in preventing aortic root dilatation that is seen in Marfan syndrome. So the flow chart here, it will show you how exactly the process goes on starting from the mutation in FBN1 gene. So the mutation in the gene coding for fibrillin 1 is a large glycoprotein present in the elastin associated microfilaments. So abnormalities in the fibrillin 1, it will lead to structural alterations, especially in elastin fiber containing tissues like eyes, periosteum, then the aorta. All these tissues may be affected, and also there will be elevated transforming growth factor beta which will contribute to the pathology. Some of the things that are mentioned in the flow chart like ectopia lentis, arachnodactyly, dilatation of the ascending aorta, all that. Let's look at some of the clinical features of Marfan syndrome. So the clinical diagnosis is done with the constellation of long limbs, dislocated lens and aortic root dilatation. These three features which makes a triad there. So the triad of long limbs, dislocated lenses and aortic root dilatation gives a definitive clinical diagnosis for a Marfan syndrome. Let's look at the skeletal abnormalities that are found in Marfan syndrome. So usually Marfan syndrome patient grow to above average height of their parents. These patients will have arachnodactyly, meaning long slender fingers which are referred as spidery fingers. They will have a change in the curvature of their spine called like scoliosis. They will have changes in the chest, either chest is indented or protruded, called pectus excavatum or pectus carinatum. Patients may have abnormal joint flexibilities, they may have high palate, malocclusions, flat feet, hammer toes, stooped shoulders, or they may have unexplained stretch marks on the skin. These are some of the skeletal changes that are seen in Marfan syndrome patients. And eye changes that are seen in Marfan syndrome are nearsightedness or astigmatism. Patient may show lens dislocation, which is referred as ectopia lentis, which is seen in about 80% of Marfan syndrome patients. And the most common direction of lens dislocation in Marfan syndrome is upward and lateral, or referred as superotemporal. Upward and lateral is the most common direction of lens dislocation. Retinal detachment and early onset glaucoma can be seen in Marfan syndrome. Coming to cardiovascular manifestations. Cardiovascular manifestations are the most serious signs and symptoms of Marfan syndrome. Patient may show undue fatigue, shortness of breath, palpitation, tachycardia and angina pectoris. Patient may show cold arms, hands and feet. Prolapse of the mitral wall or aortic walls may be seen, and which will usually result from cystic medial degeneration of the walls, and dilatation of the root of aorta or aortic aneurysm is one of the feature that is seen in Marfan syndrome. Coming to the manifestations related with lungs, Marfan syndrome patients are at risk for spontaneous pneumothorax. They may have sleep apnea and idiopathic obstructive lung disease. Other conditions related to abnormal fibrillin is seen, like mutations in fibrillin 1 gene have also been identified recently as the cause of acromicric dysplasia and galeophysic dysplasia, which are characterized by short stature, skin thickening and stiff joints. This is all about connective tissue protein called fibrillin and a defect or mutation in a fibrillin gene leading to Marfan syndrome. Thank you.